Hello, my name is Richard McManus. I'm a GP in Oxford and Professor of Primary Care Research there as well. And I'm going to talk to you in this short clip about self-monitoring of blood pressure. Self-monitoring of blood pressure, like any other kind of blood pressure monitoring, depends on the equipment that you use, and would always recommend that you use a validated monitor. These can be found, a list of these can be found on the BIHS website and are now available from around the £10 to £15 mark, so really very cheap, so most people can afford them. Having picked a monitor that is validated, then the next thing to make sure is that you have a cuff size that you're using for the monitor that's correct, and it's important to make sure that the circumference of your arm and the cuff size match. Otherwise you can either underestimate blood pressure if your cuff is too big, or overestimate if it's too small. In general, for monitoring at home, we recommend that people do at least 2 readings in the morning and 2 readings in the evening for a minimum of about 4 days. Often the first day blood pressure is a bit higher than subsequent days as one gets used to monitoring, and so it may be that you need to disregard that. We know that around 30 to 40% of people with hypertension in primary care are currently self-monitoring, but interestingly only about half of people actually ever tell their doctor. So if you're a physician or a GP, ask your patients, and if you're a patient, really think about telling your doctor that this is what you're doing. They should be interested, and if they're not interested, I would argue that you should quiz them as to why that is, because self-monitoring of blood pressure can give very important information. The normal level of blood pressure measured at home is slightly lower than typically measured in the clinic. So for a clinic reading of 140/90, we'd estimate that a home reading of 135/85 is roughly equivalent. So that's important to bear in mind. And about half of GPs in surveys that we've done don't actually take that into account. So that's something to perhaps remember. If you have diabetes or heart disease or a previous stroke, it may be that you need a slightly lower target than the standard 140/90, in which case discuss that with your doctor. Overall, we know that self-monitoring can detect those people whose blood pressure is high in the clinic but normal at home, for whom prognosis is very similar to those without high blood pressure. But importantly, it'll also detect blood pressure that's high at home but normal in the clinic, so-called masked hypertensives, who have a worse prognosis than otherwise expected. So that's my quick overview of self-monitoring. The key points to remember are: use a validated monitor with a correct cuff, tell your doctor, ask your patient, and monitor for at least 4 days. Thank you very much.